You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. AFSCME is leading a big push along with civil rights leaders and members of Congress to make sure that the next stimulus bill includes help for frontline service workers. Joining me right now is the president of AFSCME, Lee Summers. Lee, glad to have you back on the show. We have heard so much about, again, the frontline people, and we keep hearing essential, but you got to make sure, though, that if you're opening up all these businesses and opening the states back up, those folks better have PPE, better have masks, better have goggles and things along those lines. I don't think these people even care about that. They're just like, okay, whatever, open up, and then you live at your own peril.
What's happening right now, Roland, is that you have a mentality with certain people here in Washington, D.C., who believe that people can risk their lives every single day. They can be exposed to the coronavirus. They can expose their families. They don't have to work with the proper PPE, with the proper equipment, and everything is okay. Well, everything's not okay. People need to be taken care of. We have everyday heroes in the public service every single day, whether you're a nurse, whether you're a sanitation worker, whether you're a social worker, whether you're an employment services worker trying to get those checks out every single day. And they're risking their lives going into work without the proper equipment. Now they have a double whammy where state and local government are actually running out of money because the tax base is crumbling. And you have folks that have given a lot of money to the corporation to help them, helping small businesses. But by the way, we have found, and I think the conference, the Leadership Conference on Civil and Human Rights found that 90% of African Americans and people of color who own small businesses are not receiving those funds, okay? But in the public service, workers who perform tasks are not with a.
All right, you broke up there the last. So repeat that last comment, Lee.
I said that people who are providing essential public services every single day and risking their lives are now threatened with a pink slip, with being laid off, with being furloughed, because the tax base is crumbling and Washington, D.C. is not providing aid to state and local government.
Well, what you have is you also have this attitude where Donald Trump doesn't care. If it's not a red state, he only wants to support those people who can help him in the election. You got Mitch McConnell, who has said, hey, cities and states, you got problems, file for bankruptcy.
Well, number one, states can't file for bankruptcy. That's an idiotic and absurd statement. This is not a red or blue issue. This is a life and death issue for these everyday heroes, for these people who are providing public services, essential public services to the citizens of this country. And they deserve respect, they deserve the necessary equipment, and they deserve to have help from the federal government, as the federal government has helped corporations, as they have helped small businesses.
Well, on that particular point, we talk about helping these businesses. I mean, that's the whole deal. When you got the cruise industry who wants to bail out, and they're not even U.S.-based companies, okay? They're headquartered offshores for a reason. Other companies, of course, who are stashing cash left and right, and that's what's crazy to me. I'm sorry. The workers in these cities, in these states, they don't have offshore accounts.
And let's break it down further, Roland. Let's break it down further. I grew up in a household in Cleveland, Ohio, where my dad was a bus driver. That was the way, and he was organized. He was a member of the Amalgamated Transit Union. Public service was a way for African-American families to achieve a decent lifestyle, to be able to move into the middle class. And that is being destroyed right now. You look at what's happening with the coronavirus. African-American families are being affected much more at a much higher rate than white families across this country. And Black families don't have the kind of health insurance and health care that other folks have. They have pre-existing conditions. All of these factors contribute to a decline in our community of life, in our community as trying to move forward. And we need support and we need help from the federal government. And that's one of the reasons why we developed, AFSCME has developed a campaign where we are pushing the need and talking about the importance of the provision of public services. Who provides those public services? Who provides clean water? Who picks up the trash every single day? Who provides health care in this country? So we've got to continue to push that every single day. The impact that it has on the minority communities is virus, and the fact that elected officials are not doing anything to support the public services necessary to keep this country going. It's a shame. And it's ridiculous, and we've got to stand up. We've got to make our voices heard. So we're running an ad campaign, a major ad campaign all across the country, talking about the importance of public services, and the federal government must step up to the plate.
If folks want to get more information about that campaign, where do they go?
They can come to our website, the American Federation of State, County, Municipal Employee.org, AFSCME.org. We have commercials. We're even doing a letter, Roland, and I would hope that you would sign off on it. We have a letter that has been signed by clergy, by faith-based officials, civil rights organizations, talking about the need for state and local aid to the citizens of this country to continue the vital public services that everyone must have.
And in fact, so guys, go ahead and roll one of those ads. Go ahead.
We can face this pandemic head on. We can do what it takes to protect our families and our communities. Together, we can get our economy moving again, but not without the tools and resources we need to get the job done. To win this fight, it is going to take a public service army. Don't let Congress fire the frontline workers who can save us. Text FUMD to 237263 to tell Congress to fund the front lines.
All right, then. Again, Lee, this is going to be important because the reality is this is going to be the battle. And when you look at the numbers, it's a whole bunch of people who look like us who are those frontline workers.
That's exactly right. So we appreciate your support, brother. Sign that letter. We're going to be sending it in tomorrow. The National Action Network is working very closely with us on this, along with other faith-based organizations and churches and civil rights organizations. All
right. Lee Saunders, president of AFSCME. We appreciate it. Thanks a lot.
Thank you.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he's the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Braveboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist Colleges. Principal Steve Perry of Capital Prep. Health and Wellness Specialist Dr. Yolanda Hancock. Desmond Meade, President of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriot with the Root. Mina McWhorter, founder of Love by the Hand. Dr. Julian Malvo, economist, president, emerita of Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. Real quick, I want to talk a little politics here. New Monmouth poll shows Joe Biden with a 50-41 lead over Donald Trump. What's interesting, Lawrence, that when you look at that Monmouth poll, Joe Biden is only down 2 points to Trump in the category of men, has a 20-point lead among women.
As he should. I mean, his policies certainly are better than Donald Trump's, and we know the history of Donald Trump. So it would be very disturbing to see the results that we saw in 2016 with regard to women and Donald Trump. It would be very strange to see that against anybody. I thought it was particularly strange to see it against Hillary Clinton, but Biden as well. So we'll see what happens on Election Day. I predict that Biden will win. I just think that this is a disaster that we're watching with regard to Donald Trump economically and, of course, health-wise.
The issue, one of the things is, Joseph, obviously this is May, election is in November, but the reality is this here. Donald Trump had a perfect confluence of events that allowed him to win. Only won by some 78,000 votes when you combine what took place in Wisconsin, Philadelphia, and Michigan. And so he is desperate for that. But here's the deal. He's not running against somebody who's hated by a lot of people in Hillary Clinton. And so it's a different sort of election. Just your thoughts on how this election is shaping up.
Look, I think that people who think this election is over and think that they can have a coronation party for Joe Biden are probably putting the cart before the horse.
Or to say people who keep saying, oh, Trump is going to win. I keep saying, y'all, ain't nobody a lock.
Yeah, I mean, I think the reality that we face right now is that you got President Trump, who in many ways, you know, even if he's the made-for-TV president. And we're actually going to be in the situation with the first television-only event when it comes to the presidency of the United States. And for me, you know, Joe Biden's superpower, you know, whether he sometimes stutters, whether he sometimes forget his own name, is that he can get in a room with people and he can connect. And that when American people see him connecting in that deeply empathetic way, it has this power to grip a nation. Well, in a post, you know, pandemic world of COVID-19, you know, those moments don't get to happen anymore. You don't get to have that moment where Bill Clinton walks towards a lady in the audience who's talking about the national debt, but really she's talking about her own personal issues with debt and with poverty. Those moments that define presidential campaigns may not exist in this 2020 election. And so really, if you talk about the confluence that helped make President Trump in 2016, in a very strange and bizarre way, you know, the tea leaves could actually be favoring him again in an election where Joe Biden really all he had to do was stay standing up and talking to people. He might not actually even be able to do either of those things things because of the nature of this pernicious disease.
Well, don't forget, I mean, Joseph, I get your point, but ain't like Trump is young. I mean, Joe Biden's got 77, Trump, what, 73?
I mean, look, I just
so I mean, at the end of the day, coronavirus, but both of them are in the danger category.
Well, look, I don't think the issue is the age. I think the issue is the vitality. I think whether you hate President Trump or whether you love him, the one thing I don't think you can say is that he's lacking of energy.
Oh, yes, we can. Well, but here's the other deal. It's easy to have lots of energy when all your ass do is watch TV for most of the day.
Hold on. I mean, look, here's the issue. We're talking about real life, and then we're talking about political life.
No, I'm talking about real life. Donald Trump is a lazy sumbitch.
No, that's not what we're talking about, though. We're talking about how people win elections. And the reality is that you have somebody like Joe Biden, who honestly, I think we're actually watching him in decline. You can't sit there and honestly say that the Joe Biden that announced his candidacy for president has the same vitality of the Joe Biden that we're looking at today.
Have you heard?
All of the shortcomings. I think we're talking about two different things. You can talk about all of the obvious.
Lauren, hold on. Joseph, Scott, then Lauren, go.
Yeah, I mean, you can talk about all of the obvious shortcomings about President Trump. We knew them before he got elected president. They've been on full display, most assuredly, during this pandemic. But that has nothing to do with the fact that if you talk about the reasons why people voted for him, the cult of personality, that is very much still there. And I think, again, my point is that the things that people decide elections on, how they feel about somebody, did they have those moments along the trail that galvanized them? I think that the things that Joe Biden does best, he will be robbed of that because of the fact that we're in this situation where you can't have the rallies, you can't have the town halls with the audience members, you can't have those interactions with him and the crowd, talking about Bo, talking about the things that make Joe Biden the Joe that everybody loves.
Actually, Scott, that does favor Biden because you can run a far more scripted campaign. What the criticism of Biden has been are the unscripted moments.
Yeah, I agree with you. I understand what Joe is saying, but I think you can get to that through TV and the internet. Here's the problem the Republicans will have, and they can have $1 billion, is that every day Donald Trump is showing why he shouldn't be reelected, first of all, whether it's the pandemic or the economy and what have you. The other thing is he can't grow past his 40%. The independents and the moderate Republicans are looking for an alternative. Hillary was not that alternative in 2016. Joe Biden is a reasonable alternative. But black folks are going to come out and vote for Joe Biden. And because Joe Biden connects and he shows empathy across the board. The other thing about that Monmouth poll that you have not talked about is that it shows that he's got a 20% lead on women and that these sexual allegations, whatever you think about them out there against Joe Biden, the one young woman, or maybe it's two now, compared to the 20 against Trump, the Republicans can't drive that narrative because your eyes glaze over. Secondly, because of Biden's empathy and his heart that he wears on his shoulder, I think there's a fair amount of trust by men and women in Joe Biden caring about the best in this country. And you're not going to have the Comey effect. Biden isn't the boogeyman that the Republicans and the White House want to have. And so this ought to be simple. It won't be easy, though. And you got to continue to fight for every vote. And people have to vote to ensure his success.
Lauren, look, first of all, again, it's still extremely early. A lot of things are going to be coming out. But here's the deal. Trump was bemoaning the fact that the coronavirus may very well be this election may be a referendum on how he handled this. Here's the deal. If we continue to lose 2,000 and 3,000 people a day, trust me, he can't try to dance around by saying, oh, we did a great job. It was absolutely amazing.
Right. 300 people a day in New York.
No way.
Which, by the way, is the average for the murder rate in New York for the last seven or 8 years, 300 a year in murders. They're losing that a day in New York. He's not going to avoid these stats. It is him who is connected to what just happened with coronavirus. He can't escape it. We're headed toward 100,000 people dead, an unprecedented crisis. and he's rage tweeting about the Never Trump Republicans. I mean, so what Scott said is absolutely correct. It's like every day he's showing us exactly why he should not be reelected. And the fact that Hillary Clinton wasn't even all that great of a candidate and still gets 3 million more votes than he did would tell you all you needed to know. I mean, Biden is not going to have that problem. He's not going to have the Pennsylvania problem. He's not going to have the Wisconsin, Michigan problem. All he has to do, really, my view, is stay upright. And not only do I think the presidency is going to be won by the Democrats, but I think they're going to get the Senate, because there's 3 seats that are looking shakier and shakier. And when you got your top of the ticket being an idiot on a daily basis and reminding everybody why they shouldn't be elected, that typically filters down into places like Colorado and Maine. And I just think, and probably North Carolina, and I think they're going to lose the Senate over it, because this isn't going to change anytime soon.
Democrats pick up 4 seats. They take over control of the United States Senate. We'll certainly see what happens. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Braveboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. Lamina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist president, Emerita Bennett College. Coroner Michael Fowler is a mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. you can make this possible. Joining us right now is Dr. Leanne J. Webb. She's assistant professor of emergency medicine at the University of Virginia School of Medicine. And so certainly glad we're here. First, Dr. Webb, I just want to give our condolences to your friend, of course, the emergency room doctor out of New York, who passed away earlier this week. And so it's certainly been very tough for so many of doctors having to deal with this, and we've been hearing, we've had them on the show, and we're hearing from medical people who were just overwhelmed with the onslaught of what's happening around this country, and it's actually not slowing down. Part of the scare is that we're not doing enough testing, so everybody's like, this thing could easily ramp up that quickly.
Yeah, I think you're absolutely right. Thank you for the condolences. What I will say about Dr. Breen was that she was a wonderful medical director, which is basically my direct supervisor or boss when I was working at New York Presbyterian, the Allen Hospital. And she really was a fierce and passionate advocate, both for the physicians that worked under her as well as the patients. I have many great stories about her being an advocate for patients, and she will always, in our minds, be a hero. Yeah, we're mourning her loss in a really heavy way. So in terms of the testing, we have not tested enough people yet. And so, there's a lot of talk about reopening the economy. But what we know is that there have been certain guidelines set forth, some of them by the White House Task Force, some of them by the CDC. And what we ultimately know is that these are only guidelines, right? And so our Constitution is not set up so that at the federal level, they hold all of the control over what's going on from a public health standpoint. So they've issued these guidelines, and the states take it upon themselves to follow the guidelines or to not follow the guidelines. And in many cases, there are states actually skipping steps here in this phase approach to reopening, and that's very concerning. Particularly, what we need from public health standpoint to break this transmission chain is, one, we need widespread testing, and we need retesting as well. Like, we need to be able to retest people. Two, we need to be able to take those sick people and isolate them in an effective manner. We need to quarantine our sick people, and then we need enough infrastructure to actually complete the contact tracing in a meaningful way so that we can also tell those people to self-isolate, right? And so that's the basic of breaking the transmission chain of coronavirus. I understand the economic arguments. I really do. I went to business school. I understand on another level that people are suffering, including a lot of people that I know. But I do feel like in this instance, health has to come first.
Well, because look, you can have all the job you want to, but if you are sick, and then all of a sudden if you're dying, and then now you got to pay for funerals and all of that, it doesn't matter. You're a business owner like myself. You don't have a business if your workforce is out in the hospital trying to recuperate.
Absolutely. And this is the other thing about it. Some of these guidelines are not practical. So if you look at the CDC and the draft that they put it out specifically for certain groups, including for schools and for businesses that have vulnerable populations or vulnerable people working for them. In the school guidelines, it has things like keep the desks 6 feet apart. What classrooms do you know of that can really effectively
right
desks 6 feet apart?
Which now means that you probably are going to be cutting classrooms in half. So now what happens to those other students?
Yeah, so a lot of those things aren't thought through. There's another section in there which talks about what to do for employers if you have employees who are vulnerable, right? And so if you look at the employees who are vulnerable, one, they would have to raise their hands and say, hey, I'm vulnerable. What does that do in terms of discriminating against people, right, in the workplace? That's one issue. And the other thing, if you look at the specifics of the CDC's draft, is that they say if your employee, for instance, rides public transportation to work, they should be encouraged to telecommute at home. But we know, unless you're living in a place like New York City where everyone pretty much uses public transit, if you're somewhere else and you're using public transportation, 9 times out of 10, it's because you can't afford that car to get you to work. And 9 times out of 10, you're a frontline or essential worker who's getting lower pay. And you probably won't be able to telecommute from home. So some of the guidelines just aren't practical. So it's just unfortunate.
Let's see here. Questions from our panelists. Robert first, then Rob.
Absolutely, and I want to thank you so much for all the work that you and all the other medical professionals are doing. For people who are in states such as Georgia, where I am, and who are going to be going back to work and not following the guidelines as the state has set out, we haven't had 2 weeks of reducing numbers. Actually, the numbers are increasing day by day, even now, but we're reopening our economy. What will be your advice to workers who have no choice but to go back to work or lose their job? And as far as protecting themselves and making sure that they can step in where the government is not providing that leadership?
Yeah, so I think that's a really important point, and that kind of speaks back to what I was saying before, like states are actually skipping these guidelines. In phase one, there's sort of a gateway criteria that the government has put out on the federal level that says that essentially the data has to be downtrending in terms of the number of new cases and deaths and actually the number of people who are tested as well. So the surveillance, those numbers need to be downtrending for 14 days. That's what it says. And some people are skipping that. So for the worker who is forced to go to work, essentially, I'm sorry. I apologize in advance. That is not a good position for you from a health standpoint. The things you can do would be the things that we're already pushing right now. So social distancing, which is also part of the guidelines that the government has released. So making sure you're at least 6 feet away if you can. However, we know that that's not really practical. Making sure you wear something that is cloth, so a mask, a scarf, some type of clothing that is covering your face and not just your mouth, because we're seeing a lot of people. I personally am seeing a lot of people out right now where they might have a mask on, but it's actually here. So it's not actually covering their nose. It needs to be covering your nose and it needs to be covering your mask. It needs, or your mouth rather. It needs to be washable. So if you're wearing this to work every day, you need to go home and wash it every day or have multiple masks that you can actually switch out. You really need to have a serious conversation with your employer about all of the ways that you are being protected when you go back to work. And I do think that there's something that some of these non-essential businesses can learn from the essential businesses who are doing it right, but they will have to find those businesses, the employers will have to seek out those businesses locally.
Rob?
Yeah, I have one question. I have two comments before that, just based upon what you said, Dr. Webb. Two things. When you look at the economics of the situation, as you mentioned, and it's hard for people that don't have jobs, I actually think that's because of our lack of our government's response. Other governments don't have that. We haven't had, as I said, 30 million layoffs in Britain, for example, where they're taking care of about 75% of the wages and directly giving businesses money for that. So I think the answer to that is, if people can't work because of health reason, that's where we're supposed to have government. But this is by design because we have an ineffective government. Two, when you talk about essential workers, there's a general strike today. I would be remiss if I didn't bring that up, with Amazon and many others that are out there that are our essential workers that are doing the work that we all like. There's all these popular commercials because the data says it's nice to thank people, but at the end of the day, it's good to pay your workers. So with that, you have workers that, let's say you have some of these essential workers or now non-essential workers that are coming back out and they get COVID-19, what would you advise them? Because I know there's some new laws in terms of how they go about approaching their employer.
Yeah, so the first thing that they need to do is really contact their primary care doctor or reach out for medical help if they have issues surrounding COVID-19. Those people should definitely not go to, I say this as a health professional, knowing that some people feel like they're forced to go to work, but they should not be going to work. So if they're having a fever or cough or body aches, a sore throat, if they're sick at all and they're concerned that they could have COVID-19, those people should not be going to work. I hesitate to give sort of broad advice about what to say to your employer specifically. There are some protections in place for some businesses so that people can have paid medical leave. Now, I don't know what that looks like going forwards once people actually open up more of the economy. Supposedly about 35 states will be either fully open or partially open by the end of this week. And so that's a personal conversation to be had with employers and probably need to get some lawyers involved as well. But definitely they should not be going to work if they feel sick.
All right, then. Well, Dr. Leanne J. Webb, we certainly appreciate it. Thank you so very much. Hopefully, people will listen to the health experts and not the nuts in the White House who don't actually care about people's health, especially considering all Donald Trump has done has spent 3 years trying to destroy the Affordable Care Act. So we appreciate it. Thanks a lot.
Yep. Thank you so much.
All right, then. every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, Senior Economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is President of the National Medical Association, President of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, Infectious Disease Specialist, Dr. Georges Benjamin, Executive Director of the American Public Health Association, Malcolm Nance, Family Medicine Physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, Executive Director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Breeze Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and Wellness Specialist Dr. Yolandra Hancock. Desmond Meade, President of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Lamina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. Donald Trump is livid right now because one of his personal valets at the White House has tested positive for coronavirus. And so he's lashing out at his staff, saying not protecting him. No. But you're the one who went to Honeywell who didn't want to wear a mask. You're the one who has said you think it's silly to wear a mask. You're the one who has stood at news conferences with people next to you with nothing. In fact, when they had the nurses in the Oval Office, they were asked, why aren't y'all wearing masks? They were like, well, we've already tested negative for masks, so it makes no sense for us to wear a mask. Here's what he don't understand. You can test negative today, but you might be positive tomorrow. And then, of course, with Mike Pence, when he went to the Mayo Clinic, he didn't wear a mask, trying to be like Mr. Macho. Then later, oh, man, I guess I should have worn the mask, because he got criticized. And so, excuse me, Trump, if you upset because your personal valet got coronavirus, because you act like it's no big damn deal.
Yeah, we know, of course, Roland, and again, everyone now is freely using the word lie. Don Lemon has had a complete 180 conversion into blackness. everybody across the spectrum. But all they got to do is go back to every broadcast you've been on since Donald Trump has been in this presidential conversation. You nailed this from the beginning. You can't, not only can you not believe a word that he says, you can't believe anything anybody around him says. Somebody says, oh, do you think Donald Trump has coronavirus? My honest answer is, I don't know. Because you can't trust anything they say. And this man, who's one of his personal valets, is a member of the armed forces. He's a Navy guy. And so this man is risking his life walking around all these white supremacists who are, and I'm going to call it virtue signaling, not virtue in terms of good, but virtue in terms of white nationalist values. They're not wearing masks to signal to the members of their clavern that I'm with you. So this is not an accident for Mike Pence. This is not an accident for Trump and Honeywell. And as you said, finally, in the White House, in the Oval Office, when that nurse from Louisiana was like, I can't really get my get what I need in terms of PPE, my people, and he's sitting there holding himself like he always does to try to control. That's not what I'm hearing. Look, man, you're a liar. You're beneath contempt. There's nobody running the federal government on behalf of the so-called American people. And so, you know, for all we know, you're not only not asymptomatic, you might very well have the coronavirus. I have no idea, is what I'm saying. So, yeah, and he's just mad because he's a germaphobe and has been since the day he came out of his mother's womb, apparently.
Every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.R. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the group. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Okay, folks, white people are losing their damn minds. They're losing their minds. Y'all see all these dumbasses running around these states, sitting here protesting, pulling their guns out, Confederate flag, talking about we need to get back, open these states, damn it. I don't know what's wrong with these people, as if we do not have a major pandemic that's actually going on. Now, joining me right now to talk about his latest article for Medium.com, Pandemicking While White, is anti-racism educator Tim Wise. Tim, glad to have you on Roland Martin Unfiltered.
Thanks, man. Thanks for having me.
All right, so what's up? Pandemicking while white, explain.
Well, I just love that I'm the white person explainer for the show. I love that.
Yeah, well, look, when I was on CNN, I was the black explainer.
I know white people, so let me sort of walk you through it. I think there are a few things, right? Number one is, as I talk about in the piece, that when you are and have been essentially the privileged and dominant group, and you really don't face oppression, and you really don't face systemic injustice. I'm not saying white folks don't have challenges, but don't face oppression. I guess it becomes very easy for you to think that a stay-at-home order, and it's not even an order in most places, it's a strong recommendation, that is somehow tyranny, right? That's the heavy hand of the state, totalitarianism, fascism. That's a real privileged mentality, right? Black and brown folks know that tyranny looks a little different than that. Tyranny is getting, shot, John Crawford in the Walmart. Tyranny is Tamir Rice being shot in the park in Cleveland. Tyranny is police brutality and racial profiling, children in cages, deportations. But when you're white, apparently, when you look at some of these protests in Michigan and Ohio, et cetera, and you have folks standing out there with signs, not ironic signs, but legit signs that say, I want a haircut, or talking about, I want to be able to get seeds to plant flowers in my garden because it's spring and Governor Whitmer is making where I can't do that. If you think that that's oppression, right, your life is awfully sweet. So it's a very interesting insight into the way privilege functions, even in the midst of a pandemic, when millions of white folks are getting sick and thousands have died, but we still have the privilege of thinking that this lockdown, which is about protecting lives, is tyranny. So you had Stephen Moore, the economist and Trump ally, who said that these protesters are the modern day Rosa Parks, right? Comparing
in fact,
protesting tyranny to protesting orders to try to keep people alive. It's fascinating.
In fact, I'm trying to pull that up right now because, first of all, we know how much of a joke Stephen Miller is. And so let me go ahead and see if I can pull this up. Folks, go to my iPad, please. So what Tim is talking about, Stephen Moore, economist, he gave numerous interviews last week, and this is what he had to say.
We're going to see a lot more of those. In Ohio, we saw more protests today. I'm working with a group in Wisconsin that wants to do a drive-in. So, you remember the old sit-ins, but this is going to be a drive-in. They're going to shut down the Capitol. Shh, don't tell anybody. But they think they can get 1,500 people to come in. And this is great. You guys will. So we have one big donor in Wisconsin. I'm not going to mention his name. And I told him about this. He said, Steve, I promise I will pay the bail and legal fees for anyone who gets arrested. So this is a great time, gentlemen and ladies, for civil disobedience. We need to be the Rosa Parks here and protest against these government injustices.
I've asked. I mean, Tim, really? We need to be like Rosa Parks? Really?
Well, it's like I said in the piece, it's very hard to top that. But the Whiteness Olympics, look, they never get canceled, Roland. It's not like the Olympics 2020. The Whiteness Olympics are always going, and there's always competition for gold. And so about a day or two after that interview that Stephen Moore gave, there was a state lawmaker in Idaho, who I mentioned in the piece, who is from, she's a Republican from Uzbekistan, clearly Idaho, that portion of the state. And she made the comment that, when you say certain jobs are non-essential, That's just like Nazi Germany. When they said people were non-essential, they put them on trains, as if those of us who want to shelter in place are advocating that we take, all the people in the vape shops and the Pilates studios and send them to Auschwitz. I mean, it's just such an incredible lack of perspective, which again speaks to the relatively privileged position that white folks are coming from. It's the same as the Tea Party stuff. These were folks, a lot of them the same people, who a decade ago were protesting affordable health care because they didn't want to get health care from the black guy, and they didn't want to get health care if they were going to be on the same program that some black folks might be on. So they would rather die. And they made that rather clear. And and at that time, if you'll recall, what's fascinating, they were out there saying, well, we're against Obamacare because they're going to let old people die because it'll be too costly to keep them alive. But they're now saying that we need to let old people die so we can get the economy back up. So, I mean, as I said in the piece, America is on some white stuff. I didn't say stuff in the piece, but America is on some white stuff, and it's deadly.
Remember, Tim, my show's called Unfiltered. We're good.
Oh, we're on some white shit then. We're on some white shit, and these protests are a good example of the dangers of whiteness, not just to people of color, which folks of color know. I'm talking about the dangers of whiteness to these white people. You got a guy in Ohio that was one of the main guys talking about this is all a hoax, it's all BS, Governor DeWine, all these people are overreacting, and he died.
Right, his ass
he's
dead.
Not the only one.
One of the first guys, preacher, I think was in Wyoming, his ass dead. There was a fool in Louisiana, Shreveport, his ass dead. And I'm sitting there going, y'all, matter of fact, it was I love, there was a person, in fact, there was some white woman, I wish I could find the tweet, but some white woman was losing her mind on Facebook, and then this is just a joke, don't believe this, big time Trump supporter. Then a few days later, her family posted a GoFundMe to pay for her funeral expenses because she's dead.
Right. And what's sad about this is we're being given this false choice. You either go back to work and risk your life, or you stay at home and the economy crashes. There are other ways of doing this. We could, if we really cared about people as opposed to our economic orthodoxy that white conservatives in particular are so bought into, we could do something different. Denmark right now is paying people the equivalent of $50,000 US dollars per person to just stay home, stay healthy, and then shut the economy down until this thing is done. But in this country, we are so slavishly devoted to the idea of the unfettered free market and hyper-capitalism that the idea is, no, we got to go back to work. We got to go back to work. And there is another alternative here that we're just not wanting to investigate. And the people who are running this thing clearly, are more and willing to embrace a eugenic mentality that says certain people are disposable. The rally here in Tennessee, where I live, yesterday or 2 days ago, there's a woman with a sign that says, "Sacrifice the weak, reopen Tennessee." I mean, that's the kind of thing that if someone on the left or someone of color were ever to have a sign that said something like that, or to show up at the Capitol with guns strapped to the teeth, as these folks in Michigan did, we know what would happen to them. We know how they would be viewed. They would not be viewed as patriotic, liberty-loving Americans. They would be viewed as insurrectionaries. They would be arrested. They would be shot. They would be gassed. And the president wouldn't be signal boosting them on Twitter. So this is about a soft civil war, as people have talked about. This is about attempting to use mass death as a wedge issue in a culture war that this president wants to wage on behalf of whiteness. And that's what this is.
And that's exactly what you're dealing with. You're dealing with somebody who is trying to gin up his white base. I got to read this comment. Got to get your thoughts when you talk about the craziness of whiteness. You have... from my home state, one of the most idiotic, asinine individuals. Look, I keep saying that the three dumbest governors are Brian Kemp of Georgia, Ron DeSantis of Florida, and Tate Reeves of Mississippi. The fighting those three for dumbest elected official is Dan Patrick. Okay, a crazy, deranged right-winger. I used to debate Dan when he was a conservative radio talk show host on the NBC affiliate. He is, I would dare say, 100 times crazier. This is what this fool said last night on Tucker Carlson's show. When he was previously About, some of us should accept dying for the future of our kids. He said, quote, "What I said when I was with you that night," go to my iPad, Henry, "there are more important things than living, and that is saving this country for my children and my grandchildren and saving this country for all of us." I don't want to die. Nobody wants to die, but we've got to take some risk and get back in the game and get this country back up and running. Okay, but I'm going to deal with this quote. Tim, there are more important things than living.
Right. Right. Well, let's just be very clear. It's because of the lives that are mostly at risk that he says that. I said this last week on Twitter. If COVID-19 was affecting disproportionately white, disproportionately, healthy, disproportionately prime of life, disproportionately evangelical Christian folks, for some reason, let's say this virus had a thing out for white folks or evangelical white Christians or whatever. If it was killing, or if it was just even killing disproportionately people in the prime of their lives, the way, for instance, the 1918 flu did. It was a weird thing. It actually affected young people more than old people. If COVID was doing that, none of these people who are saying, well, sacrifices have to be made and maybe some folks have to die, but it's the American way, they wouldn't be saying that. The reason that Patrick and others are willing to say that is precisely because the people who were disproportionately affected are working class and people of color and people who were already sick. So this is the eugenic mentality of, historically of all fascists. It's the eugenic mentality that animated this country in the late 1800s, early 1900s, from which Hitler borrowed. It's that same mentality. There's certain life worth living, and we will protect them at all costs. But others, they're marginal and they can be sacrificed. That's the only reason he's saying that. If this was disproportionately affecting people like him or younger than him, people in their 30s, let's say, or 40s who were white and middle class or above, he would never say that. And these folks wouldn't be out protesting at state capitals with guns.
And also, I take it that you certainly agree that Donald Trump, he needs aggrieved, angry, we have no idea what's going on with white folks in order for him to beat Joe Biden in November.
Yeah, it's the only hope that he has. And it's a calculated gamble on his part, because if things get opened back up and there's a huge uptick in illnesses, obviously a lot of that is going to hurt him politically. But he probably figures, well, I got no choice. My economy is in the tank now. The only thing I can do is take the chance. And if people die, I'll try to blame the governors. I mean, but this is all about his politics. This is about a guy and about a movement that has, as we've been saying, lots of us for a while, but it's more and more evident. It is a death cult. It is people that are willing to drink the Kool-Aid, just like folks with Jim Jones, walk off the cliff like lemmings on behalf of their dear leader. There's no philosophy behind this. Look at the signs at these rallies. They're all over the place. You got anti-vaxxers, you got the QAnon nut jobs, you got the people that just, Jesus is my vaccine. You got people that have signs about every possible cause under the sun. There's no coherent philosophy. The coherent philosophy here is this conspiratorial, they're all out to get Donald Trump and we must support him. This is cult behavior, and we don't have any obligation to be respectful to these people, to talk nicely about them. Our only obligation is to defeat them mercilessly every time we get the chance.
Tim Wise, we certainly appreciate it. Thanks a lot.
You bet, man. Thank you.
All right. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patal Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression. in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist. Dr. Georges Benjamin, executive director of the American Public Health Association. Malcolm Nance, family medicine physician, Dr. Jen Caudle. Dr. Tashaka Cunningham, a molecular biologist. Kat Stafford, she's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University. Congresswoman Yvette Clarke from the state of New York. William Springs, AFL-CIO economist. Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Enriquez Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. The Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks, a new strain of coronavirus that has become dominant around the world appears to be more contagious than the previous versions has been recently identified by scientists. This new strain first appeared in Europe in February and quickly migrated to the East Coast in the United States. In a new study, scientists wrote that this strain has been dominant around the world since mid-March. This strain may make people vulnerable to a second infection. Man. Joining us right now, Joseph Graves, professor of biological sciences at North Carolina A&T. Doc, you were on here a few weeks ago, and you said other strains are being developed and that we have to understand that there might be one strain, but this thing can mutate, and we're just sort of just chasing after it as it keeps mutating.
Yeah, Roland, again, I hate it when I'm right about things like this, but people in my field have been predicting for some time that as the virus infects more individuals, it's going to accumulate more mutations. New strains are going to evolve. And there's always going to be a trade-off between two aspects of what the virus does. One thing the virus does is it replicates many copies and it makes the host sick. That's what we call virulence. The other thing it has to do is it has to be able to transmit to another host. And that's what we call transmission. Those two things always trade off against each other. And generally, what you see through the course of an epidemic is a reduction in virulence, meaning how badly they make people sick, but an increase in transmissibility. And those two tend to equilibrate. In other words, they're always working against each other. In the 1918 pandemic, the first wave was not as transmissible, nor was it as virulent. But the second wave actually had both of those things. It was extremely transmissible and it was highly virulent. And that's the strain that killed most of the people in that pandemic, which eventually petered out at approximately 100 million people worldwide.
So here you have them talking about opening up states. We still have not had widespread testing. And so now with this new strain, we're just truly operating in the blind.
Again, I couldn't agree with the congressman who was on a few minutes ago about how you cannot reopen the economy without widespread testing and contact tracing. It's absolutely an insane proposition to be trying to open the economy now with the infrastructure we have to deal with infectious disease. And the worst part of it is, again, political leadership in this country, particularly out of the White House, is continuing to reinforce the idea that this is not a serious issue. When you have the vice president going to a hospital not wearing a mask with people who are vulnerable to infection disease, you send a message to people about how much you really think about what their lives are worth. And unfortunately, the White House has been involved in divisive, destructive rhetoric, which is going to cost more and more American lives.
So, moving forward, what do we do? How do we prepare for this, knowing full well with these different strains? And so, what do you tell the average person out there who might be coming back into the workplace? Now we're talking about public transportation, restaurants. What do we do?
You have to assume that everybody's infected, including yourself. And so therefore, the individual has to take steps to make sure that they don't make someone else sick. And that's going to involve more and more people wearing masks in public. It's going to involve changing the way we're going to be in public with regard to physical space. It's going to involve constant hand washing, cleaning of surfaces. All of these things are now going to be the new normal with regard to how we behave. Because as I've again said on the show, this pandemic is the first of many to come. Unless we change the way we live, and quite frankly, I don't see that happening in the near future, we're going to be seeing pandemic after pandemic after pandemic. So instead of hoping that these disasters aren't going to happen, we really need to change our thinking as a society, and particularly, again, political leadership is going to play a crucial role in terms of preparing the infrastructure to defend critical portions of the economy, such as workers who work to bring food to people's table, workers who work to keep the lights on and the heat on and to pick up the garbage. All of these things need to be done with an understanding that from now on, dangerous infectious disease is always going to be something that we're going to have to deal with as a society.
So I'll ask you this. So you say we're going to have to deal with pandemic after pandemic after pandemic based upon the way we're living. Why? What exactly about how we're living that's going to drive that?
Okay, one of the biggest problems we have is our population density. So you'll notice that when you look at the United States, the hotspots are in the biggest urban areas. And so when you have that many people close to each other, and particularly congregating in public spaces, riding on public transportation, that's basically a smorgasbord for viruses and bacteria to be able to infect more and more people.
So what do we do? I think did Skype freeze? Okay, so let me know when we get Doc back. I want to bring my panel in. That certainly is not something that we really want to hear, Brooke. I don't know if, again, our leaders are properly preparing people for how life is about to be for us now in the future.
No, because too many of them right now are preparing people to go back to normal, even though not only do we not have a vaccine, we don't have adequate testing, but we still don't know much about this virus whatsoever. And everyone right now seems to be, even the mayors and governors who've been like killing it are all, I've noticed, like really focused on how do we go back to normal before we even have any full understanding of this, before we get any real control over this. We just have more hospital beds now. And so it's like, all right, that's the best we can do. This has all been frustrating and it's scary.
And see what you're dealing with when you have people, Malik, say, liberate Michigan, liberate Wisconsin. There's people protesting in Massachusetts. And, well, this is just a hoax, whatever. That's 71,000 number. Then you see the report where the White House now trying to downplay where it could be even higher. Now Trump is trying to move his number. Remember, it was 30, then 50, then 60, then 65, then 70. Now he's talking about 100. Hey, if as Governor Andrew Cuomo said, if you don't change how you operate, you're not going to get the numbers under control.
I think you made the point a few weeks back when you were talking about what the president himself is ultimately responsible for. We're having conversations about opening up the government or the economy. And the reality is that this is a decision that has been left up to the states. The states are controlling when they decide to open themselves back up. What's happening is that there's a lot of information that's going back and forth. And some of it obviously is in the media. But I think what the challenge moving forward, as we're seeing, is, and we had the conversations about how to protect the workforce. So I actually think that I think that OSHA should get involved. I think there should be some sort of federal standard as far as worker protection. OSHA is the agency. If you want to protect workers against, blood-borne pathogens or exposure to lead, or even our fall protection standards for people who do businesses, build buildings and things like that, that's where OSHA can get involved. So I think from a federal level, that's something definitely that I think it's a good idea for Congress to actually focus on that. I'm not sure if the administration, maybe some sort of directive, maybe that's something that they can do, but this is something that needs to be memorialized in law because, as everyone has been saying, this is going to be around us for a very long time. So as far as protecting workers, I think that we're onto something as far as trying to get OSHA to change some of those regulations to address it.
Before I go to Kelly, I want to bring in Dr. Graves back. We've got his Skype taken care of. So, Doc, we talked about, again, how we have to change. So what should be our MO moving forward, in terms of how we're operating every day?
Well, I think there needs to be fundamental changes to how we live. And that's really going to require making fundamental or asking fundamental questions about what kind of society we want to live in. The idea of having, populations concentrated in such small areas is something I think we really need to revisit. But to be able to do that, you also have to start thinking about, well, how are you going to produce the basic needs of life so that instead of having all of the means by which that production happens concentrated in small areas, we need to think about how we can do these things in a decentralized way. Now, one of the good things that would come out of that sort of decentralization is that would also require us having a bigger labor force. And that means people who have been chronically and as many economists would call structurally unemployed would have to be brought back into the labor force if you're going to do things in a decentralized way, and particularly things like growing food, processing food, doesn't have to be done all in one place. So in fact, I was on a call with some colleagues who are researchers in microbial evolution and viral disease, and we were all talking about the fact that unless we make these fundamental structural changes in how we're living, then the pandemic is going to be the new normal.
Dr. Graves, I certainly appreciate it, man. Thank you very much.
Thank you.
Kelly, I don't think that leadership is prepared to actually do this, and I believe that is a shame. And the crazy thing is, if Trump actually had enough sense, which he has none, enough sense to do this, Actually, people respond that way. But as long as he keeps burying his head in the sand on this whole deal, and he's only fixated with the economy without understanding all of this impacts the economy. You can't get what you lost unless you prepare people for life moving forward.
Not only can you not do that, you can't have a functioning economy without a consumer. Consumers are people. You cannot consume anything if you're dead. So if we do not get a handle on this virus and viruses to come, because that's what viruses do. Once we get a vaccine, the virus responds, it'll mutate, and so on and so forth. We have to keep responding to this. We should have been on a proactive tip regarding this particular novel coronavirus because we had enough information ahead of time in order to get ahead of the ball on it. But like you said, we have a president who is inept and who kept his head in the sand regarding these issues, actually fired the people who could sooner do something about it. And now we are where we are because of this ineptitude. But like I was saying previously, we need to have a structure such that the economy is not the priority. People need to be the priority. Profit can't happen without people. Money can't be spent without people. The economy is non-existent without people. And right now, people are dying. So if we can't get a handle on this, nothing else matters. So we need to really shift our focus to people. We need to shift our perspective on this issue and have a more humane response as opposed to something that is strictly or predominantly economic based.
Every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, Senior Economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is President of the National Medical Association, President of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, Infectious Disease Specialist, Dr. Georges Benjamin, Executive Director of the American Public Health Association, Malcolm Nance, Family Medicine Physician, Dr. Jen Cardle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, Executive Director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist, Principal Steve Perry of Capitol Prep, health and wellness specialist Dr. Yolandra Hancock, Desmond Meade, president of the Florida Rights Restoration Coalition, Cliff Albright, who is the co-founder of Black Voters Matter, Michael Harriet with The Root, the Mina McWhorter, founder of Love by the Hand, Dr. Julianne Malveaux, economist, president, Emerita Bennett College, coroner Michael Fowler, is the mayor of Atlanta, Keisha Lance Bottoms, mental health therapist Suzette Clark, Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr., Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District, Dr. Leon Madugal, president-elect of the National Medical Association, Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.